We are Healthcare Partners of Nevada. We promise to earn and keep your trust.
We promise to treat you like family.
We promise.
We promise.
We promise to be an important part of the community.
We are Healthcare Partners of Nevada.
We're Healthcare Partners of Nevada.
We are Healthcare Partners of Nevada.
Contact us today to learn more about our promise to patients and to find out how you can see a Healthcare Partners doctor.
I was shocked. Surveys on calorie intake and food consumption by teenagers in the United States show that the percent of calories consumed from sugary drinks has doubled in the last 10 years to where now, instead of 10% of the person's calorie coming from sugary drinks, it's a little bit over 20%. I don't fault Mayor Bloomberg for trying to legislate something. 6 out of 10 people in the city are heavy. He understands what most politicians and policymakers do, which is that health translates into higher costs for everyone, more taxes to pay for health care, overall higher health care dollars. I mean, let's face it, he is a little bit messianic about the things he believes in. But we try to regulate health and welfare in all aspects of our lives, whether it's safety of vehicles, safety of food products, safety of medications, airline safety. None of this is a surprise to anyone, but I think for a lot of people, the issue of food and food intake and what you can drink and how much you can drink is taken very personally.
What about diet sodas?
The diet soda itself has no calories, but the diet soda by itself isn't going to make someone heavy. There's no caloric value there. But studies show that when you take that to replace calories that you want to get rid of, you end up taking them in through something else. So let's say you have your diet soda. That doesn't seem to stop people from having a supersized fry and a triple Mac. So there you go.
What would you recommend a parent or an individual to do instead of going the direction of these high-calorie drinks? Should you go to water? Is teas a good idea, or what?
First, I think you have to know how to read a food label, and you have to actually read it and ask yourself, okay, as part of my daily intake of food and drink, where does this fit in? Does it fit in? So I think it starts a little bit with food education, which relates to knowing about the ingredients and building blocks of a healthy daily diet. And part of that is knowing how to read a label.
Some people don't look at the drinks as something that is taking in calories. They look at their food. Well, this is what I ate today, but they don't count those other drinks.
I think again, it's an educational matter. It's not easy to tell people, oh, just drink water. I mean, who wants to drink water? It doesn't have much taste. It doesn't give you a buzz. You know.
So as far as that's concerned, definitely look at everything that you're taking in per day.
I think it is, and that ties into a conversation we had recently about making different choices in foods and how that can lead to better health over time. There are no miracle cures here. This is all over time, but the good habits start young.